Hello, and thank you so much for coming to my presentation. Today we will be discussing preparing for a whooping cough outbreak. So whooping cough, also known as pertussis, is a respiratory disease. Millions of people have contracted whooping cough within the United States. It's highly contagious and it usually spreads from one person to another. As we said before, the disease usually spreads from one human to another by coughing or sneezing, where you share the same space as somebody. Even touching the same surface as someone who has whooping cough can be enough to transmit it. Most babies who get whooping cough are often infected by their caregiver. Whooping cough is often spread between mother and child. And affected individuals are most contagious up to approximately 2 weeks after or from the beginning of the symptom onset. So symptoms, signs and symptoms. Symptoms can develop within 5 to 10 days. Sometimes it could take up to 3 weeks. It starts with cold, flu-like symptoms, and sometimes a person can also develop a mild cold or fever. The disease sometimes causes violent and rapid coughing that is consistent until the air is gone from the individual's lungs. Inhaling produces a loud whooping sound, which is where the name whooping cough comes from. So identification of pertussis outbreaks. So the easiest way, or the most common way to identify a whooping cough outbreak would be through PCR tests. These PCR tests tend to vary with their specificity. When the test has high specificity, the results tend to be positive, and this confirms that a person actually has pertussis or whooping cough. So diagnosis and treatments. So usually providers of healthcare do diagnose the pertussis disease by considering the previous exposure of an individual. This is done by typical signs and symptoms, history of an individual, performing a physical examination, performing laboratory tests, and performing blood tests. So diagnosis and treatment continued. So whooping cough is usually treated with antibiotics, but this should be done early. The incubation period, it's usually 7 to 10 days, but it could sometimes be between 14 and 21 days. This is, like we said before, this disease is extremely contagious. Those infected are contagious for 21 days, but this can be reduced by antibiotics. So the most important thing with whooping cough is protecting children, or should I say one of the most important things, because it can be extremely dangerous for infants and babies whose immune systems are not all the way built yet. So the CDC recommends that mothers be vaccinated with the Tdap vaccine during pregnancy. The vaccine should be administered from the 27th through the 36th week of pregnancy. So prevention. The best way to prevent whooping cough would be vaccination. Antibiotics, this is recommended to people who already have whooping cough, so other diseases and bacteria cannot make whooping cough worse. And always, good hygiene is recommended to prevent the spread of the disease. So prevention for healthcare personnel. Healthcare personnel who are going to be in direct contact with patients who suffer from whooping cough must be given a single dose of the Tdap vaccine. This is done to those who have not been previously vaccinated, and the dosage keeps them safe from infection. So for healthcare personnel in charge of prevention, so healthcare personnel includes the following categories of physicians, nurses, emergency, medical, and support services personnel, therapists and laboratory technicians, students and people taking medical courses, dental specialists, social workers, and chaplain, and anybody volunteering in the medical system. So in conclusion, we need to learn to categorize patients to determine the urgency of treatment. With this categorization, this will help our employees and practitioners to attend to patients who are needing the most care. As a private hospital, we need to ensure that we work with our local community, inform them about the outbreak situation, and assure them that we are doing everything the best we can to stop the spreading of whooping cough. To protect our community, we all need to work together, which means any possible infected people need to be reported right away. And this is the only way that we can prevent the spread. And also, anybody who is reported to have whooping cough needs to be reported to the state health department. And thank you so much for your time. And that is all I have for you. Thank you so much.